Stress Physiology, the real management of diabetes that we misunderstood. Hi, everyone. This is Real Easy Med Terms. In this session, we will learn about stress physiology, the real management of diabetes that we misunderstood, Chapter 1. Exercise therapy that lowers blood sugar level quickly. 1. Exercise therapy that lowers blood sugar quickly. Before time, there were not as many diabetics as there are now. In the past, diabetes was a rare disease among the upper classes who enjoyed fatty foods and did not engage in manual labor. The reason is nutrition and exercise. In the old days, blood sugar could not go up much, because there was not enough food, and the body used up the sugar, by moving a lot, so the symptoms of diabetes would not have appeared, as severe as it is nowadays. On the contrary, in modern times, sweet and greasy foods are easily accessible and people live in a lack of exercise, so if you have a stress response, you can develop diabetes immediately. The first aid method for hyperglycemia is exercise. Just as taking painkiller when you have a headache, if you exercise when your blood sugar level is high, your blood sugar level immediately goes down. When you exercise, your blood sugar level drops faster than you think, by pulling glucose from the blood into the cells, in order to secure an energy source for muscle cells to move. This happens because resting muscle cells cannot absorb glucose without insulin, but exercising muscle cells can absorb glucose without insulin. However, lowering the already high blood sugar level is not the only goal of exercise. If you move your body to improve blood circulation, you can prevent blood clots and inflammatory substances that are formed when blood is stagnant. No less important than that, is to regain a positive and active lifestyle, and pleasant and happy feelings, that can shake off helplessness or fear, and help fighting stress through exercise. Exercise not only has an effect on mood change, but it also builds control over one's body, which is the basis for regaining the initiative in life that was taken away from stress. Exercise is also important for type 1 diabetes patients, who get insulin injection every day. This is because it is easy to be obsessed with feelings such as low self-esteem, guilty conscience, loneliness, and fear, regarding the difficult life that began at a young age. Because these emotions can intensify the stress response, and create a vicious cycle of worsening diabetes again, you need to be consciously careful, not to involuntarily fall into negative emotions. For people with type 1 diabetes, it is more beneficial to exercise together than to exercise alone. By doing so, they can overcome feelings of isolation and develop a will to compete, giving them the confidence to face their fears. Also, the importance of exercise increases, because adrenaline secreted from the adrenal medulla during exercise suppresses autoimmunity, the cause of type 1 diabetes. Exercising is essential for people with severe diabetes, but it is not recommended to exercise hard enough to collapse. It is appropriate to do it only enough to feel good and want to do it the next day. The reason is that too strenuous exercise can become stressful in and of itself, releasing a lot of stress hormones, as well as losing motivation and preventing you from continuing to exercise. Another reason why vigorous exercise is not good is that the more you exercise, the more acidic metabolites, such as lactic acid or ketone bodies, are produced, which can cause metabolic acidosis. Diabetes patients are running out of pH buffer systems that can neutralize metabolic acidosis, and chronic stress reduces their blood flow to the liver and kidneys. As a result, the rate of recovering from the aftereffects of exercise is significantly slower than that of healthy people, because the rate of metabolizing lactic acid from the liver, or excreting ketone bodies and hydrogen ions from the kidneys, is slow. Therefore, it is ideal for diabetic patients to do light exercise regularly, and it is recommended to soak in warm water after exercise to create an environment where fatigue substances accumulated in the muscles can be easily decomposed. In this lesson, we learned that the first aid for high blood sugar level is exercise, because the cells of exercising muscles can take up glucose without insulin. We also learned that we need to regain control over the body and initiative in life, through exercise. In the next lesson, we will learn about the types of food that worsen acidosis. This is Real Easy Med Terms. Have a great day. See you again.